email us or connect with us on social media.
Hi, I'm Lonesome Mary and Body. To find out what is happening in our city, please watch our council meeting on Monday nights at 7 p.m. on Rogers TV.
Another night of gun violence in the city.
Bullets were flying, sending many fleeing for their lives.
They're shooting in public places. They don't care.
A brazen daylight shooting.
What we're seeing now is terrorism.
Going underground.
I've never seen a gun that looks like this before.
To expose Toronto's illegal gun trade.
There's everything you can think of. AK-47s, AR-15s.
How hard is it to find a gun in Toronto?
It's practically point and click.
Veracity, The Gun Chase, Tuesday, April 27th, only on City TV.
You're watching Rogers TV.
Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guests to the program today, I'd like to share a few thoughts with you. For those of you who watch the program, you know that we like to give you an update on our COVID-19 status here in Grey Bruce. So as we speak today, there's no doubt that we're in a very rapidly changing landscape, and we anticipate over the next few days this will continue to change. The Grey Bruce Health Unit is declaring a critical threshold of COVID-19 cases in Grey Bruce. As a result of the increasing case numbers, the Public Health Unit contact tracing and the case management capacity is being stretched to its limit. If we as a community do not implement drastic measures at this juncture, the pandemic will spiral out of control. The Grey Bruce Health Unit is asking the public to help. Everyone across Grey Bruce needs to consider themselves a carrier for the next 48 hours until we reach all case count and their contacts. If contacted by public health, be prudent in following the direction that is given. It is a priority that everyone stay at home except for essential travel. This direction is in addition to the provincial stay-at-home order. A class action order from the Medical Officer of Health will be issued to further reinforce the need for case and close contacts to follow public health direction. Individuals who have symptoms are asked to attend an assessment clinic. The Grey Bruce Health Unit, you are asking the public to continue to practice the 3 W's. Watch your distance, wear a mask, wash your hands, and please stay at home unless absolutely essential. The sacrifices we make each and every day will help to prevent the spread of COVID-19. All of us together can make a difference, and we can save lives. I want to thank all of you in the community for all that you are doing to contain COVID-19 and all that we will have to continue to do to stop the spread of COVID-19. And on that note, I want to also thank my guests today, who are very busy people, but who are here to talk about COVID-19 and strategies as we know them today. So I'm welcoming Kevin McNab and Rob Hatten, Grey County Paramedic Services and communications experts, who will be talking to us about where we are in space and how things have been happening through Grey County. I'm wondering if each of you would just fill us in a little bit about your role, and then let's run right into what's been happening since we talked so many months ago. So thank you for being on the program. Who wants to go first?
You're higher ranking, Kevin. How about you go first?
Okay. Well, good afternoon, everybody. My name is Kevin McNab. I'm the Chief of Paramedic Services for Grey County. So my job is to oversee the department and the initiatives and safety for the paramedics, the response to the paramedics, care of patients, and I have a great team underneath me of management team, supervisors, and paramedics and administrative support, to ensure that we respond to the community appropriately for all the work that we've been doing out there as far as responding to the day-to-day 911 calls, as well as the additional initiatives that we've been doing for COVID-19.
Great.
And Rob?
I'm Rob Hatten. I'm the communications manager with Grey County. That is my everyday position, but in situations like we're in now, I'm also the emergency information officer on the Grey County Emergency Control Group. So being in communications and being on the emergency control group, I get to be plugged into pretty much a little bit of everything and the various aspects of emergency management. I'm fortunate I have a team that we've been working very hard for the last while to try to get public health messaging out to the public and inform them of what's going on at the county level and how it's impacting our programs and services. And a big part of that is working with members of the local media, and we're so fortunate to have community partners like Rogers TV and like yourself, Carol, that give us these opportunities to get our messages out there. So I really do thank you for that, because that is making a big difference.
And thank you. And we all can celebrate in the future when we really don't need to be having a conversation about COVID-19. I remain very optimistic that we will get through this. We're just in a really challenging time right now. I think communications, we're recognizing more and more how important it is to help the public with feeling confident, having trust, and feeling like they're getting timely information, because this is frightening for many, many people at this point in time. So I'm really interested in the role of the paramedics over this past year, because more and more, I think paramedics are really definitely, we know you're essential frontline providers, but the government is looking to paramedics to deliver services in new ways as well as frontline people. Kevin, I'm wondering if you'd like to fill in on some of the things that your paramedics are actually doing out there in the community.
Sure, and we're so proud of the paramedic work that they've been doing. They've, jumped into this role, over and above their regular 911 response, which is already causing, some angst to them about the unknown of the virus, the risk of taking it home. But even on top of all that, responding to 911 calls, they are offering programs now where they're doing COVID-19 testing in the home. They're working with public health around vaccination clinics and hubs. And last week, we just started with homebound patients. Through this, we've developed a palliative care symptom management program, working with the palliative care outreach team and the palliative physicians of Grey Bruce. We're doing vulnerable patient referrals for people that are in their home that are requiring assistance. We're referring to 211 community connections, to home care, and to addiction services. One thing we just launched in the last few weeks is also a community naloxone distribution. So we're able to distribute naloxone in the community if we're on a call where there's been an opioid overdose, that we're able to ensure that the people on the scene have naloxone. So we're involved in a number of different initiatives. Very thankful to be working under Dr. Era and the medical officer of health and his team, and also the hospitals and the physicians around the palliative care, with all the partnerships that we have. Again, we're part of the team, and the paramedics are a very important part of that team.
And would you have ever anticipated 2 years ago doing these types of programs and services through the paramedic service? Yeah, well,
you've obviously heard about our community paramedic program and the non-traditional roles that paramedics are playing in the community around working with patients with chronic disease. And, with the palliative care symptom management, that would be something that, that through COVID has helped move it along. But that was something that had been taking place in the province. Paramedics had been doing vaccinations, particularly around flu. So a lot of this stuff, I think it's a transition of a role and a modernization of our service. But I think these are all things that, that come to the forefront that we're able to assist with.
Yes. I'm wondering then if you can explain a little bit about people who need the service, how you provide. You mentioned you're actually delivering the vaccines now in homes for those. So who gets that service? How is it communicated? And how do you really organize all this? It's quite an organizational feat, I would think.
Yeah, for around the COVID-19 testing and vaccination, we work directly with the public health under Dr. Era and his team. For testing, there is a group within public health that we assign these roles. They will contact us with patients that need testing in the home. And typically these are patients that can't make it to an assessment center. So we travel all across Grey County providing this testing in their home. Sometimes it's even rapid testing that we can clear patients as well as do the one test that we have to send away. It may take a couple days to get back. And then as far as the vaccinations go, we started out working in the hubs and these congregate settings, working with the public health team. And just last Friday, we started working with homebound patients. So those patients, the list of patients is provided to us by public health, so that we work with the nurses from there. We've only done one of these clinics, but we meet in the morning. They drop the medications. We have a list of patients that we go out to see. We have 6 hours, from the time that medication's drawn up to the time it's administered to get to these people. So yeah, like I think last week we did on Friday we did 19 between two different crew, two paramedics out in two separate vehicles traveling throughout the county. And our hope is to continue for anybody that's homebound or housebound that we will be able to do that.
So Robin, your role with communication, this is the type of information that you would be distributing to people as well, correct? About how the services roll out and what services are provided?
To a degree, when it comes to the public health aspects of this emergency, what we really tend to do is try to echo public health's voice and let them take the lead on the messaging. So we're in regular contact with the team over at the health unit and pushing out where it makes the most sense. We also have to make sure that our messaging is being targeted and it's going out to the appropriate people, because we need to make sure that we're not setting expectations to the broader community for things like in-home vaccination. So we really do try to work through public health, getting those messages out.
Yes. It sounds like there's such a significant amount of coordination of information and coordination of services working together through Grey County to provide this. Any surprises for either of you as we've moved through this? Anything you've never anticipated? Any positives that you're experiencing? It seems odd as we're increasing numbers of COVID, but anything positive that you've seen?
I think that there's been a lot of positive stories of resilience. I think anytime something bad is going on, I like to try to look around at the people who are helping and all of the positive things that are going on. And even as fatigue is kicking in this late into the pandemic, we're still seeing the community come together and support frontline healthcare workers and other individuals. We're seeing businesses go above and beyond in the modifications that they're making to their services and pivoting their service delivery and doing what they need to do to really make sure they care for the community. And that's one that always jumps out to me. And it's something that I think we've come to expect from our community, that degree of resilience, but it's still overwhelming every time that I see it in action.
Yeah. How about you, Kevin?
For paramedics, I can't say enough of how proud I am of the paramedics of Grey County, how accepting they have been for not only to respond to their traditional 911 role through a difficult time, but also their ability to pivot and do other roles within the community. So that's a very positive, and it shows that paramedics can do these non-traditional roles and be successful at them. But I think on top of that, and it still speaks to the same, is that we're only one part of the team. And, whether we're talking with Dr. Era and his team at Public Health, who's been, such a magnificent leader through this for us, as well as whether it's hospitals or other community agencies, physicians, those relationships. I think that's one thing in Gray. We've always had really great relationships with our community partners, but this just exemplifies it. I really say, there can be all kinds of plans for this type of response, but the big thing of this is cooperation, working together, and that's really at the end of the day, helping each other out. That's what we've tried to do.
I certainly understand too that everyone knowing their role and following within that role while cooperating and coordinating with others, I think is a key to our success with partnering, that people respect who can do what in what particular role, and everyone is willing to work together for the common outcome, and that's our community safety. And that, I think, is really evident in the services that you provide. So with the paramedics, there is no doubt with the enhanced services that you're providing that you are out there in the highest risk situations, other than in an intensive care unit or a hospital, because you're going in and you're testing people in their homes who may be COVID-19 positive. That's a huge risk. How do you protect the paramedics, and are they feeling the stress?
Yeah, from the start, our number one priority is to protect our staff and protect our people so they can respond and stay healthy. So it starts with leadership, with Dr. Era. We've been on the phone many times, 11 o'clock at night, 11:30 at night, 7 in the morning, 8 o'clock on a Saturday night. I can't say enough of between him and his staff as far as guidance to us through this. And then from that guidance, he's met with our staff at least 2 times, if not 3 times, on the Zoom meetings, just for him to come and talk about the situation. And then as far as the staff go itself, is ensuring that they have all the information that's required. As far as learning about the disease and appropriate equipment and supplies, making sure that they have appropriate face masks, whether it be surgical masks or N95, and face shields and gowns and gloves, that they're comfortable wearing this. When we first started this through this journey, even ourselves, even just PPE was hard to come by. It was amazing how quickly in January we struggled to find PPE. And again, we've been very successful in Gray to be able to make sure that we have appropriate PPE, but I can't say I didn't lose some sleep at night, actually ensuring, and thinking about where we're going to find some days, but it always worked out. But really that's the thing, is ensuring that that the paramedics have the right education, also that the most up-to-date information comes out, and then the leadership through public health and following the science. And then from there, everybody working together. But to say that they're not concerned, they are concerned for sure. Anytime that they're out there, always respectful and mindful of that they have families at home, and the concern is they don't want to infect themselves or their partner or their patients or their own family. So again, it has to be taken very seriously. And again, we put whatever measures are in place. Have either come directly from our medical officer of health or from the province.
And one thing I might add in there too, Kevin. Yeah. Sorry, Carol. Is as vaccines did become available as well, we were fortunate that our local public health was identifying paramedics as an important group that did need to be in on those early stages of vaccination. So we were fortunate to take advantage of that as well.
And I think that really lends itself to the fact that here in Grey Bruce, we are pioneers of many unique ways of doing things, whether it's the 3 Ws or the hockey hub or using the paramedics. I mean, that's one of the unique and amazing things, I think, in our community as well. There's a couple of things I'd like to chat about. One is we've talked about COVID, but there's also the concern about the opioid overdose situation and the crisis. And certainly would be interested to hear, about how that's affecting paramedics and what you're noticing. And the other is around, I know you did chronic disease management. You would go into homes and keep an eye on people with chronic diseases. Now that they're not accessing their physicians in their offices the same, is there a concern that some of these chronic conditions may become aggravated because of the fact that they've been a little bit distant from that regular monitoring they might have had through a physician or anyone else? We've heard from the hospitals sometimes people are delaying too long before they go in and get checked out at the hospital. And just wondering if that's a pattern that you're noticing in the community.
Well, I guess the first one I'll talk about is opioid overdoses. And we've really seen this for the last 3 or 4 years as far as rising cases of opioids. I would say 2019 was our highest year. Last year wasn't quite as high, and this is for the paramedic response. But I can't speak to the community response. But as far as the paramedic response, we had a few less cases. But this year, we have seen an increased amount to the point that it could be higher than what it was in 2019. So it is very concerning for us to ensure, that people, that if they are using opioids, that they don't use alone, that they have naloxone on site, and people call 911 to ensure that, that we keep these people safe. We work day and night with this. We have alert mechanisms built in anytime that there's a call that involves an opioid call. Not only does it alert our management team, but also alerts public health. And, we've been on conversations late on a Friday night, early on a Saturday morning, always monitoring the situation, ensuring the community messaging gets out when there is changes in the community. Again, back to partnering with public health and all our community agencies. It's so important in our response. Just something recently that we were able to add, and I'm so happy that we're able to do this, that if we go out to a scene in the middle of the night and they've used all their naloxone, the paramedics now are able to leave naloxone on site, so they won't be without when we leave if there were still people there that potentially could use after we're gone. So that's good that we're able to do that. But there's a lot more work to do. Like the thing with these opioids, there can't be, it's a life and death. That the one small dose of this it will kill you, and it's so severe and so dangerous that again, there's a lot more work to do. And COVID has definitely taken over a lot of the response, but I want people to know that it's still top of mind for us as well.
So with your paramedics, how do they cope? I mean, I just can't even imagine how difficult it must be when they have to attend someone and they're not able to revive them because of an overdose. What do you do as a leader in helping your staff, Kevin?
So mental health and paramedics has been a focus of ours for a number of years now. And again, not saying we don't have a lot of work to do, but we work hard to ensure that they have supports in place. One of our main programs is we have a peer support team that reaches out to them with a consulting psychologist that ensures that paramedics are checked in on after the call to make sure they're doing okay, and getting them help that they need if they need help. That's one of our biggest focuses. We have alerts built into our system that notifies our team if these calls take place, so they can follow up with them. And just letting them know that we're here for them, and if they need care, that we'll support them in that care. Again, with a professional. Our goal is to get them, if they need care, is to get care as quickly as they can. We don't wait for delays of whether you're approved through WSIB or those type of things. Our philosophy is if you need care, go get the care, and we'll sort it all out afterward. But don't delay to getting care.
Excellent. And not that I want to forget you, Rob. I will get back to you. But the other question was around those with chronic disease processes and whether you're seeing any changes as a result of them, perhaps, just dealing with that in a more isolated way.
Yeah, well, we've continued with our patients through the initial wave. We actually switched over to phone visits, but then we started back up with regular visits, and we actually maintain that. And working with the physicians in that group, we have about 145 patients in that roster right now. And again, we continue to treat those patients under the direction of the physician. I'm happy to say that starting May, I don't know if you've heard or not, but we are approved for what they call the CP Community Paramedic Long-Term Care Program. And so right now we have rostered roughly 150 patients, but our goal is to roster another 300 to 350 patients and add another 3 cars across the county. So the paramedics are just in training now, and in April we'll begin with the expansion of that program.
Excellent. So Rob, from a communication perspective, what have you seen and what do you anticipate? I think we've got about 3 more minutes in the program, so.
Well, in communications, we really need to be reactive right now. I think that we can only approach this on a day-by-day basis, looking at the information and the data that's in front of us as far as the pandemic and what that might play into decisions in the future. We're in regular contact with our emergency control group meeting, and actually Kevin and I have a meeting this afternoon, which I'm sure is going to be a very informative one. And from that really guides our decisions. We've learned a lot of lessons over the last few years. I anticipate that we are probably going to have a busy summer in Grey County as far as visitation, just based on what we saw last year with people from the region coming up and enjoying nature in our area. So we know that is a really important thing to people, especially people who have been cooped up in condos and apartments. And we know that we have some work to do. So we are working with Trails Group, and we're trying to mitigate the risks associated, the public health risks associated with this, as well as the impacts on the spaces. So that's something that we're working on right now. There really, though, it's just that day by day at this time. As vaccine clinics continue, we're promoting that. Grey County is volunteering a bunch of our staff at these hubs to help roll those out. And really, we feel that in this whole role right now, the best thing we can do to help us get through this is support these vaccination clinics and get us steps closer to getting back to normal.
And I must say, I agree. Certainly, I've volunteered a couple of times now at the hub as a volunteer screener, so I get to ask all those questions. So I have seen the paramedics there, and I've seen all of the volunteers in the health unit, and it's a remarkable arrangement, but it's also uplifting to see the community come together to try and take care of each other, and the joy on people's faces as they walk through those doors saying, finally, I'm here. And it's a rough go, but it's also, you get those moments of reward when you can see that, and for sure. I want to extend an invitation to both of you. There's no doubt that things are changing rapidly. We're here to communicate for you in any way that you need to. Please do not hesitate to reach out to us. We feel it's our role as well to work alongside anyone who is trying to keep our community safe and restore well-being. So if you have information to share, you know how to reach us. Don't wait for us to invite. It's an open invitation, and I want to thank you both for what you're doing. There is no doubt everyone is working together to save lives. So thank you both. And take care of yourselves. Take care to our viewing audience as well. Please tune in again for more information about programs, services, and resources available to you and to your family. Take care, stay safe, care for each other. Thank you.